Hi, my name's Tawnie. I'm going to take some x-rays of you today. Can you tell me your first and last name?
Sure. First name is Scott. The last name is Robinson.
And your date of birth?
Is 9/25/1971.
Alright, let me check your wristband. Alright, that matches up. You can come on back with me. I'm going to take a couple x-rays. So I see that we're going to do some x-rays of your wrist. Can you tell me which wrist that we're doing today?
Going to x-ray my right wrist.
Okay, and can you tell me what's been going on with that wrist?
It just hurts. It's been hurting for about 2 weeks now.
Okay, did you fall or have any trauma on that wrist?
No.
Okay, so we're going to start out by placing the patient at the end of the table. I'm going to put lead on the patient. I'm going to put lead on the patient's lap to protect their gonadal region. And so what we're going to do is we're going to start out by doing a PA projection of the wrist. So we're going to have the patient place their right wrist up onto the IR, because that's the wrist that we are going to be examining today. And we're going to be using a 10x12 IR cassette. We're going to be using 62 kVp at 4 mass on this shot. So we're going to, with the hand pronated, we're going to arch the hand slightly to place the wrist carpal area in close contact with the cassette. The CR is perpendicular to the IR, directed mid-carpal area with a minimum SID of 40 inches. We're going to collimate wrist on all 4 sides to include the distal radius and ulna and mid-carpal area. And we're going to place your marker. Patient shielded. You got your kVp set, and you're ready to take your PA projection of the wrist. And we're going to move on to the second shot, which is going to be a PA oblique. We're going to do a medial and a lateral oblique. We're going to be using a 10x12 cassette lengthwise, kVp of 64, and a 4 mass. So you're going to align the patient's wrist, a portion with the eye bar be exposed, and we're going to rotate the wrist and hand laterally at a 45-degree angle, and we're going to be using a sponge to support the wrist. So for the medial, lateral, we're going to be rotating the wrist laterally and center perpendicular to the IR, directed to the mid-carpal area, minimum SID of 40 inches. Collimate the wrist on all 4 sides to include the distal radius and ulna and at least the mid-carpal area. Make sure you have everything all nice and lined up. We're at a good 45-degree oblique. You're going to place your marker. And you're going to take the shot. Beep. You're going to take the cassette out. Place a new cassette, 10x12. And we're going to do a medial oblique. Have the patient put their arm back on, and this one you're going to have them rotate medially, and sometimes you find it a little bit easier if the patient actually rotates their entire shoulder over. It helps with positioning that wrist a little bit better. So again, you're going to use a 10x12 cassette. Place the wedge at a 45-degree angle, medial. You're going to use a 64 kVp at 4 mass, and you're going to center ray perpendicular to the IR, directed to the mid-carpal area, a minimum SID of 40 inches, and collimate the wrist on all 4 sides to include distal radius and ulna, and at least to the mid-carpal area. Place your marker. and take the shot. Beep. And take the cassette out. And we're going to do another shot laterally. Have the patient, again, a lateral is a lateral is a lateral, and you're going to hear that many times in this course. But you're going to have the patient put their arm like they're doing a karate chop is usually what I say and I ask patients to do, and that works out best. Let's get them nice and centered. Column it in. Just make sure everything's all nice and straight. You're going to be using a 10 by 12 cassette IR, 64 kbp at 4 mass. You're going to actually have the patient seated, but you're going to have the patient flex their elbow at a 90-degree angle, and make sure that the shoulder, elbow, and wrist are all on the same horizontal plane. You're going to align the center hand and wrist with the long axis of the IR. Adjust hand and wrist into the true lateral position. Fingers comfortably flexed. And if they need support, you can always put a little bit of support under their fingers if they need it. The central ray is perpendicular to the IR, centered to the mid-carpal area. And the structure shown in this is a distal radius in all the carpals, and at least the mid-carpal area is visible. Place your marker. Make sure everything's all lined up nice and straight. Tell the patient not to move. And you go take your shot. Boop. Next shot, we're going to be doing a PA projection with radial deviation. And the question that you need to ask is to make sure that there's been no possible wrist trauma before a routine series. So you want to rule out possible fractures and make sure that the patient has not had any trauma to the wrist before performing this x-ray. You're going to start out with a 10 by 12 kbp at 64 with mass of 4. So you're going to have the patient put their wrist back up onto the cassette for PA projection, palm down, wrist hand aligned at the center axis portion of the IR being exposed. So without moving the forearm, you're going to gently invert the hand medially toward the thumb side as far as the patient can tolerate without lifting or obliquing the distal forearm. You're going to center the perpendicular to the IR, directed at the mid-carpal area, minimum SID of 40 inches. Place your marker. Make sure everything's all lined up nice and straight. And take your picture. Beep. This concludes the PA, or the wrist series. Thank you for watching.